cancer centers. I'm medical hematologist, oncologist, and practice president here at the Cancer Center. Today, we'll be discussing COVID-19 and cancer as people had questions, and we'll be discussing some topics that are important to all of you, as well as all of us, certainly. We've had some questions already come in from the public, so we're going to answer some of those first, and then we'll see if there is some time left over for some questions for all of you to ask, certainly. So one of the first questions we have is many patients asked if they should stop their treatment during the COVID-19 pandemic. And the answer is absolutely not, but it does require a doctor-to-patient conversation. Cancer is potentially curable, and you don't want to delay your treatment in trying to reach for that cure. We put in a lot of precautions in place to make sure you can get through your treatment, certainly. But a doctor-to-patient discussion certainly needs to be had, I think, especially in diseases that we're trying to get rid of forever. Cancer itself is a scary word, obviously, but a virus shouldn't stop you from getting the treatment that you need and deserve, and a timely manner, certainly. So the other thing we're doing to help with treatments and to make sure patients get seen adequately is we've implemented telemedicine, so your physician can talk to you over a computer or a cell phone, for example. So you don't have to come into the office as much to go over side effects and manage those, certainly. But if you do have any signs or symptoms that you have pertaining to your disease or your diagnosis, certainly let us know. We are open and we want to see you, and we'll be happy to see you. But there's no reason why you should delay the treatment. One of the things that we've learned, obviously, over the last few weeks and couple of months is the number of prevention procedures, mammograms, CAT scans, et cetera, all have been delayed for lots of reasons. We encourage people to start getting those events. It's critically important. Cancer can be prevented if caught early, and we certainly want to encourage that. The radiology centers are starting to open up back for business, especially starting next week. And we'll be happy to set those appointments up for you and help you through that process, certainly. So another question we had was, we often hear, does treatment increase your risk for contracting the virus? And the answer then is, of course not. Your chances of getting the virus are from person-to-person contact. Somebody who has to be infected has to give you that infection. Now, what is critically important is, especially if you're on treatment, your immune system can be compromised. And if it is compromised, your recovery from the virus could be longer or have a potential serious outcome. But if you have the right precautions in place, if you shelter in place at home, minimize your exposure risk, your chances of getting the virus are no different than my chances of getting the virus. And that's very important to remember. That's especially important if you have a caretaker helping take care of you. We encourage everybody to minimize contact, isolate as much as possible. If the caretaker does have to go out, they should wear a mask outside in public to help prevent them from catching the virus so they don't bring it inside the house. Let's see. One of the other questions we get asked, should you stop any treatments or any vitamin or supplements that we recommend? At this time, no. I think if you're in the middle of treatment, you should try and finish that treatment out. There's no recommendation made by the CDC or any government agency that says stopping the treatment benefits or does not benefit. Sometimes we may modify the treatment depending on what type of cancer you have and what treatment you're on. We may skip a treatment if you're on maintenance treatment, if everything else is stable. But there's no reason to stop the treatment, especially if then you're trying to reach a curative diagnosis. So if you're in the middle of treatment, talk to your physician. It's critically important that you do that because it is a patient-to-doctor decision. And depending on what your physician says, then you can certainly decide if the treatment needs to be stopped or delayed or continued. Let's see, what have we done to help make sure that our patients are safe? Well, we like other organizations, have put in a pretty rigorous screening process. Every one of our offices, patients and visitors get screened. We've limited the number of visitors that come into our clinic, and we've limited to 0 visitors in our chemo room, as well as a radiation infusion area, treatment area. The other thing is we finally have enough masks that We can say if you don't have a mask and you're coming in, we're going to offer you a mask. We're doing hand sanitizer out. We clean each room, each chair that's touched after each patient visit. And at the end of the night, we do a deep clean at all of our offices to try and make sure the environment is as safe as possible. We also try and maintain that 6 feet social guideline. It's hard sometimes in a small office space to do that, but we're doing our best. We try and limit the number of patients that are in our waiting room by having them sit every other chair, or sometimes even waiting in the car if needed. So we're doing our best to try and keep our patients as safe as possible during all of this. If you have any questions or concerns, please let us know. Certainly, at any given point in time, we're here to help you. If any questions come through now, we may be able to answer them, certainly. So, but at the same time, we want to make sure that it's important that the message gets across that during a cancer fight, it's important that you keep in touch with your cancer provider. It's important that you try not to miss your appointments, especially your lab appointments. It's important not to ignore a symptom. I think that's the biggest thing I can say. Because you don't want to end up in the hospital on something we could have taken care of over the phone or with some antibiotics or whatever. So it's important that patients really, really talk to their providers and keep in touch with the office. If they have any concerns, please let us know. We're here to help, certainly. We'd like to thank everyone for joining this brief, afternoon Facebook Live chat this afternoon. If you found this helpful, please leave us a comment on our webpage or ask questions on the webpage. We'll be happy to answer them. I hope this certainly helps anyone and everyone who've had some basic questions or thoughts or concerns about their treatment and what to expect. If this is helpful and we get enough people interested, we can certainly do a series of these if more questions come around in the future. But be well, please stay safe during this pandemic and stay COVID-free, as I call it. So, virus isn't going away. We'll do our best to keep everyone healthy. We thank everyone for joining us. Thank you all.